there are many drugs in this group. We can know some benefits of each one. Okay. Now we have seen aspirin. Now look at the next things that we have seen. Aspirin was what? Salicylic acid derivative. It was non-selective COX inhibitor. Similarly, there are many non-selective COX inhibitors. Let us look at this one, propionic acid derivatives. Here you have ibuprofen, naproxen, fluorbiprofen. What you have to focus on here is all of them have pro in the name, like propionic acid, right? Ibuprofen, naproxen, fluorbiprofen. Okay, most of these are oral. Ibuprofen is actually, it is better tolerated than aspirin. It's very widely used and it can be used in children. It does not cause Reye's syndrome. Naproxen, it is also anti-inflammatory. You can write all those general things. And it is in rheumatoid arthritis. They seem to be preferring naproxen. Okay. Then fluorbiprofen, it is used in osteoarthritis and rheumatoid arthritis again, and ocular inflammation also you can use. Fine. If you can remember, you can remember. Then coming to the other group, that is phenamic acid derivative. Phenamic acid derivative is so easy. Mefenamic acid. What is it? Mefenamic acid. Quite easy to remember actually. Mefenamic acid derivative, it has analgesic, antipyretic and weak anti-inflammatory effect. It is used in dysmenorrhea or osteoarthritis, rheumatoid arthritis. Just remember, if a person is complaining of periods pain, you can give them mefenamic acid. Okay. Now coming to the next category, you have the acetic acid derivatives. Acetic acid derivatives, ketorolac and IndoMethacin. Please remember this. Keto, acetic, ketone, acetic acid, ketorolac, IndoMethacin. This is very important. IndoMethacin is very important. It has been asked for you in short notes. So please remember IndoMethacin. Note, it has extra mechanism, extra uses, extra side effects. IndoMethacin has extra mechanism, extra uses, extra side effects. Okay. It can be given orally via eye drops or suppository. What is suppository? So basically suppositories are solid dosage forms that are inserted into rectum. So you can give IndoMethacin via the rectal route. It can be given oral route, eye drops and suppository. Okay. Dosage is 50 milligram. If you want to remember, you can remember. Coming to the uses, it's a non-selective COX inhibitor, obviously, and it's an acetic acid derivative. It has potent anti-inflammatory effect. See, I'm just going to put it this way, the uses and the side effects. Uses mainly for IndoMethacin. So you can write all the other uses of NSAIDs, but mainly when it comes to IndoMethacin, you have to write these points. It's a potent anti-inflammatory drug. It inhibits the migration of neutrophils to inflamed area. What is it inhibiting? Inhibiting chemotaxis, correct? It's inhibiting chemotaxis. It is very good in spondylitis, gout and psoriatic arthritis. You can use to treat these. What and all are you using against? You're using it against spondylitis, gout you can use, and psoriatic arthritis. Okay, let me tell you what each of this is. Okay, so we have found what these are. Ankylosing spondylitis is actually something to, so spondylitis is going to be your spine. Okay, it's affecting your spine in any large joint. So this is called as ankylosing spondylitis. It is also called as Bacterus disease. Just remember bacteria. Bacterus disease. Okay. Gout also you can use IndoMethacin, and psoriatic arthritis. It's a type of arthritis that affects people who have psoriasis. Now what is psoriasis? It's a skin disease. What causes it? Any infection or sunburn also can cause psoriasis. Okay. So these are the uses, specific uses of IndoMethacin, which is an acetic acid derivative. Now coming to the side effects of IndoMethacin, you have to write these. Prominent side effects are the GI side effects because the homeostasis is affected. Then CNS, the central nervous system is affected, which is really bad, right? So IndoMethacin can cause headache, confusion, hallucinations, not at all nice, and it is contraindicated in patients with epilepsy and any psychiatric patients because definitely it is going to increase the confusion and hallucinations, and drivers because it can cause again headache and such things. Okay. So till now what and all we saw, do you remember or you forgot already? Let me revise it for you till now, whatever we have done. We saw ibuprofen, better tolerated in children. Naproxen, rheumatoid arthritis. Ibuprofen, then mefenamic acid, that is phenamic acid derivative we can use in dysmenorrhea. Ketorolac and IndoMethacin, which are acetic acid derivatives. Okay. Now let us move on to piroxicam. It is an enolic acid derivative. It is also having anti-inflammatory effect. You can always write oral and topical gel for most of these. It is long acting. Which is long acting? You can say this one, piroxicam. Fine. Then it is in peptic ulcer will be the side effect that you can write for almost everything. But remember, we saw lithium toxicity causes lithium toxicity. Remember, that's why you should not come.